Hello everyone, my name is Olamipo Adekoya, and this presentation is on Proactive Health Communication Campaign, Sexually Transmitted Infections in Baltimore City. So my topic is on sexually transmitted infections, otherwise known as sexually transmitted diseases, so I'll be using these two terms interchangeably. In 2018, there were 2,457,118 cases of sexually transmitted diseases in the United States. And for the last 5 years, the rates of STDs have increased every single year. Women are biologically more prone to acquiring STDs and more likely to have serious complications from it. Young people, gay and bisexual men, and pregnant women are also at an increased risk of getting an STD. In the world, there are greater than 1 million sexually transmitted infections, STIs, acquired on a daily basis. Also, every year, there are about 376 million new cases of infections, with at least one of them being one of these four STIs: chlamydia, gonorrhea, syphilis, and trichomoniasis. The agenda is to create a health promotion campaign via social media to educate teens and young adults 15 to 24 years in Baltimore City about safe sex, prevent them from having unprotected sexual intercourse, and ultimately decrease the rate of sexually transmitted infections in Baltimore City. Age so that age group 15 to 24 years, in a lot of the statistics kind of grouped that age group together. So as opposed to doing teens separately and doing young adults separately, I decided to do it as a combined unit, if you will. So Baltimore City has the highest rate and the most reported cases of STIs in the state of Maryland. In 2017 and 2018, Baltimore City had the highest rate of reported cases of chlamydia, over 1,200 and 1,300 cases respectively, per 100,000 population. In 2018, Baltimore City had over 1,200 more cases than Prince George's County, which had the second highest rate of chlamydia. In 2018 as well, Baltimore City had the highest rate of gonorrhea in Maryland. And in 2018, Baltimore City had the highest rate of primary and secondary syphilis in Maryland. In 2018, males aged 20 to 24 years old had the highest rate of gonorrhea, about 727 cases per 100,000 population. In 2018, females 20 to 24 had the highest rate of chlamydia, about 4,525 cases per 100,000 population. Now that's pretty high. When it comes to teens, in 2018, females and males 15 to 19 had the second highest rate of chlamydia in Maryland, 3,850 cases per 100,000 population, and 1,312 cases per 100,000 population, respectively. In 2018, female teens aged 15 to 19 had the second highest rate of gonorrhea, about 567 cases per 100,000 population. So why is this really a big issue? Teenagers and young adults 15 to 24 years old account for 13% of Maryland's population. Yet, 64% of reported chlamydia cases and 44% of gonorrhea cases were seen in this age group in 2018. Chlamydia rate in teens and young adults 15 to 24 years is 5 times higher than the rate in all other age groups in Maryland. So people who are 25 and above, the rate of chlamydia in teens and young adults 15 to 24 is 5 times higher the number of the rate of chlamydia in all other age groups, which is pretty significant. Gonorrhea rates are 4 times higher among teens and young adults 15 to 24 years than the rate of all other age groups in Maryland. Now, the Healthy People 2020 objective on STIs is one, to reduce the chlamydia rates of females 15 to 25 years who are testing positive to chlamydia in the last 12 months to 7.2%. Now, if we compare that, in 2018, there were 64 people 64% of the population, 64% of the population that reported chlamydia, positive chlamydia results. And the Healthy People 2020 want to bring that number down to 7.2%. They also want to reduce the gonorrhea rates of females aged 15 to 44 years to 251.9 new cases per 100,000 population. They also want to reduce the number of cases of males aged 15 to 44 years with gonorrhea to 194.8 new cases per 100,000 population. So they are trying to bring down these numbers. So what could be done? The campaign, and why is it important to do it? So the campaign is important as teens and young adults 15 to 24 years in Baltimore City make up a small percentage of the city. Yet more than half of the reported cases in 2018 on chlamydia were seen in this age group, and less than half of the reported cases in 2018 of gonorrhea were seen in this age group. So this campaign will utilize several social media platforms, including YouTube, Instagram, Snapchat, and Facebook, to educate teens and young adults about unprotected sex and its consequences, and will support them in making lifestyle changes to combat this disease. So the theory that I use is Pender's health promotion model. Now, the basis of this theory is that every person has characteristics and experiences that affect how he or she behaves and the consequences of those actions. The goal of the theory is that health promoting behavior will result in improved health, better quality of life, and improved functional abilities. Pender's health promotion model gives a backbone to this topic and explains that many factors contribute to a person's decision to engage in unsafe sexual practices that result in STIs. An unmotivated person cannot make the necessary changes to maintain a healthy life. So this theory would help me understand this population better and would help me seek out the past experiences, character traits, environmental factors like the kind of home and neighborhood that these teens and young adults live and the kind of role models that they have. So help me seek out all these things that are causing patients to practice unsafe sex, have multiple sexual partners, offer sex in exchange for money or material things, and then it would enable me to devise an education plan that targets this population. So what is my strategy? So I know that teens and young adults 15 to 24 are usually very active on social media sites like Instagram, Facebook, Snapchat, and they also watch videos, movies, and skills on YouTube. When they want to learn new skills, they watch YouTube videos. So the goal is to create a Facebook group that will provide education and mentorship for participants called Love and Protect Yourself. That will be the name of the Facebook group. Educational videos will be shared on the Facebook group and would include information on risk reduction sexual education, the use of condoms and condom availability programs, expedited partner therapy for treatable STIs, sexual consent, and consequences of unprotected sex to include STIs and pregnancy. Group members can comment with their ideas, thoughts, and even ask questions on the group publicly if they feel comfortable. And for anyone who does not feel comfortable or needs one-on-one advice, they can send a private message on Facebook to one of the admins and have their concerns addressed. I will work with Facebook, Instagram, and Snapchat to push 30-second ads on their websites for male and female patients within the age bracket of 15 and 24 with a link to the Facebook group for more information. These ads will contain content about sex education. And finally, I will work with YouTube to play this educational video as an ad in between videos, still targeting this population when they're watching videos. So in between their videos, this ad will come on so they can see it and they can click on the link to take them to the Facebook group. Thank you so much for listening, and these are my references.